Welcome back to Addiction and Treatment. In this part, I'll start by looking at detox. For some people, it might not be safe to just stop using substances without medical intervention. It'll depend on the level and duration of their usage, and crucially, whether they've ever had a withdrawal seizure. Withdrawal seizures, in the worst case scenario, could cause brain damage or even death. So, how and where might someone get a detox? Well, there are three common locations: at a residential rehab at the beginning of treatment, possibly at a specialist detox facility, or in a regular hospital. A hospital detox is likely to be triggered because the patient has been admitted for some physical injury, probably linked to their drinking or drug taking. And unlike the other two, the rehab or the detox facility, it probably will only last a few days, usually a week at most. An alcohol detox is likely to take about 2 weeks, while with other drugs it's about 3 weeks. Those timescales could vary depending on the medical assessment when the person is admitted. The most common medications used are Librium and diazepam. You might know that one better as Valium. Valium is mainly used to treat acute anxiety and seizures. Librium is also used to treat anxiety and acute alcohol withdrawals. Both of these drugs belong to the benzo or benzodiazepine family, which makes them quite dangerous if not taken under medical supervision, and usually in reducing quantities, because they in themselves are very addictive. At this point, I want to clear up a common misconception about detox. It will safely remove the substance from the body, but it isn't addiction treatment. Addiction is a mental health condition. So now let's look at what treatment might look like. And before that, we'll begin by considering the cycle of change. So if you look at the top left segment of the diagram, you'll see the pre-contemplation stage. The person doesn't recognize there's a problem and they're not thinking about change, so they're still in denial. Moving then in a clockwise direction to the contemplation stage, a problem is recognized and change is being considered. This may be triggered by a reprimand at work, family breakup, illness. There are many reasons why people come to recognize that there's a problem with alcohol or drugs. And any of these stages could last for a short time or a very long time. Unfortunately, some people stay stuck and healthy change doesn't come about. That results in death, psychologically, spiritually, and eventually physically. We then move down to the preparation stage. Change has been considered, and the person is preparing to take some kind of action. That could be anything from talking to somebody, researching drug and alcohol services in their area, perhaps finding out about local 12-step recovery meetings. And then at the bottom we have the action stage, where the person is doing something to bring about change. This might be making a phone call to a treatment centre, going to a 12-step meeting, asking a doctor for help or advice about a referral to the appropriate service. It could be any number of things, but it will involve taking action or doing something. And finally, the maintenance stage, which is about adjusting to behavioural changes and engaging in relapse prevention strategies. This is what's called being in recovery. And this will mean many things to many people. It could include attending group therapy, aftercare groups, individual therapy, perhaps combined with a 12-step recovery program. And that brings us back to relapse, because relapse is quite common. But it's important here to say that while it may be quite common, it's by no means inevitable. These are some of the common areas that addiction treatment will focus on in group therapy, and in some settings there may be individual therapy alongside that. Helping the person to build some sort of structure into their day is important, particularly in the early stages of recovery. There'll be some form of education about addiction. We usually call these psychoeducational groups because they're a mix of therapy and education. This helps people to understand the psychology of addiction and hopefully also helps them to see that rather than bad people becoming good, they're unwell and trying to become more healthy. There should be some focus on loss and change, because of course all change means that something has to be lost, whether that something is healthy or unhealthy. Relapse prevention will be a central focus. This will look at common relapse triggers, as well as helping someone to identify those that are specific to their own lives. It might also include formulating strategies to stay safe at a family or social event, like a wedding, a funeral, a holiday, a work social situation, whatever it happens to be. Feelings will also be looked at. Remember, common feelings can include shame, guilt, self-loathing, and anger. People need to be helped to firstly identify these feelings and to express them in more healthy ways rather than acting out by taking a substance. And of course, it's important to examine relationships with the self and with others. I believe that a substance can sometimes be a substitute for intimacy. In other words, an open, honest, and communicative relationship with yourself and with those around you. So that's more or less detox and addiction treatment. I hope you found it useful and that I'll see you soon again. Take care.